Good afternoon, ladies and gentlemen, and all of those who are watching me today. I thank you for coming back to watch yet another one of my videos. This is episode 50 of my YouTube channel, and this is one of a series of videos that I'm recording to highlight the challenges and issues within the American healthcare system. I am offering up my personal story as a way of providing a case study of how not to do healthcare in the United States of America. This particular series of videos started with me recounting my employment with a company called VinFin Corporation, which operates here in the state of Massachusetts. I worked for this company in the year 2019 from April 1st, 2019 to November 1st, 2019. That was the duration of the period of time that I had a working relationship with the company. What follows in these episodes that I am now recording is the history of what I experienced from November 1st of 2019 to the present day. I am recording this video on Sunday, November 29th, and it is my goal to complete the full storytelling of this time in my life no later than January 1st of 2021. So, in this episode, I begin starting with November 1st, 2019. This was the last day of my employment with VinFin and the first day of what was a very harrowing period in my life. After leaving employment with VinFin, I left the state of Massachusetts for a period of time. I went to stay with a friend in the state of New York. However, I was hospitalized repeatedly after November 1st. As I have recounted in the previous video, I began ending up hospitalized in August of 2019. I was first hospitalized at Cape Cod Hospital. I was later hospitalized at Massachusetts General Hospital. I was then hospitalized at Bournewood Hospital, and then in November came more hospitalizations. I was hospitalized at Terra Vista Hospital. I was hospitalized at Pembroke Hospital. I was hospitalized many, many times. And what is amazing and appalling to me is how even ending up in inpatient hospitals for people with mental health conditions, I still did not get the care I needed for months and months after November 1st. I was hospitalized repeatedly, and the doctors and the care staff never properly managed my care as well as they could have because they were not working with a proper diagnosis. They were not using complete and correct information. Their understanding was not significant enough, complete enough to help me in the way that I needed help. And so here I'm going to start speaking more as an advocate and not just as a storyteller. One of the things that needs to happen, I believe, in this country, in Massachusetts, and certainly in other states, because Massachusetts is considered to have one of the best healthcare systems in the country, from what I understand. It's one of the reasons that I will continue to live here despite the failings that I feel I personally experienced. One of the major issues that I see that exists based on what I experienced is the transfer and communication of medical information, medical histories, relevant information in patients' histories from one facility, from one provider of care to another. I do not know now with certainty the thoroughness with which my medical records were reviewed when I was hospitalized once and twice and 3 times and more times. I don't know with certainty who all reviewed my chart and what all they saw in that chart with each hospitalization where I went from one hospital to another to another. And so one of the fundamental problems I think that needs to be addressed is the efficiency and efficacy of the transmission of medical data to ensure the best patient care possible for people seeking medical care. So after I left my position at VinFin, I was hospitalized several more times. I was hospitalized, as I said, at Pembroke Hospital, where I had a psychiatrist treat me there. I was hospitalized at Terra Vista Hospital, where I worked with a doctor there. Eventually, I was removed from these medications that I was put on by the psychiatrist in late September on Cape Cod, which were compromising my ability to function. I was no longer walking around like a zombie like I felt like I was in early October of that year. So, things did improve to a degree, but only to a certain degree. I was hospitalized in late November when one of my aunts passed away in the state of Arkansas. Her death was a great blow to me because she was something like a surrogate mother to me when I was a child after my mother developed schizophrenia and had to eventually move back to Germany. My Aunt Carol was a wonderful, generous, kind person who died, in my opinion, far too soon. At the time, that's what I thought. I later came to a different opinion, which I'll share later. She was a wonderful, generous woman. She never married. She became kind of the consummate caricature of the old cat lady. She had cats throughout her life. She had lots of cats when she was in the process of dying. She lived for much of her life in the house that she grew up in the small town in Arkansas where she and my dad and their siblings grew up. I was devastated when she died, and I was additionally devastated by the fact that I would not be able to go to her funeral because I myself was still hospitalized. I learned about her death while I was hospitalized. I was not able to see her body. I was not able to go to her funeral. But what I did do was, after I was discharged from the hospital, I drove all the way to the state of Arkansas to go to the cemetery to pay my respects to her. And that trip was one of the scariest trips of my life. And it was scary to me because I was still having significant symptoms. I can remember driving during the day, especially when I was in the state of Arkansas once I had reached the state on my drive from Massachusetts, and feeling scared of the sky, feeling as if the sky, the beautiful sunlit sky above me, was going to somehow fall down and crush me like a heavy curtain of iron. It was one of the most surreal, nagging, troubling feelings I have ever had in my life. That the sky that I loved to look into, the sky that I fell in love stargazing into as a child, would somehow become this menacing, scary thing that would fall down upon me and crush the life out of me, crush my car. It was one of the strangest symptoms, anxieties I've ever felt in my life, that the sky itself would crush me. And I made it all the way to Arkansas, and I stayed with a cousin of mine, and I went to the cemetery, and then I had this very unwise notion in my mind to just move back to Arkansas, where I had lived before at one point in my life, and start a life there. And it was completely inappropriate to my needs. It wasn't realistic. It wasn't healthy, because Arkansas has one of the worst healthcare systems in the country, because they are a poor state in which conservatives set policy that is not supportive of the health and needs of so many people, but people vote for it anyway. For me personally, it was not a good place for a man who is gay, who has health issues as I do, to live. But at that time, in that space, in time, in that moment of my own thinking, I was imagining it making sense. Ultimately, I left, and I drove back to the state of Massachusetts. But on my way out, I had an accident. I had an accident as I was driving back to Massachusetts while I was in the state of Pennsylvania. I ended up hospitalized. It wasn't an auto accident. It was an accident in which I used my medication and had severe consequences arise from my misuse of my medication. And I want to stop here and share a reason why I am taking the courageous step of sharing this piece among the many pieces of my recent life journey. I have a lot of heroes in my life. There are many people that inspire me, that give me the strength, the warmth, the fire in my own heart to have the courage. And the word courage comes from the French word coeur, which has to do with the heart. There are many people that inspire me in my ability to have courage and muster my courage and use my courage the way a car uses gasoline. I have reflected on and shared the stories of many people that inspire me in my video series focused on what I call my top influencers. Those people have given me courage. Those people inspire me, and in some cases, those people have really forged my ability to be a courageous man. I was terrified, as I said, on that drive. I was terrified. I felt like the sky was going to fall down upon me. One of the people here in the state of Massachusetts who gives me the courage to say what I'm going to share is the mayor of Boston, Mayor Marty Walsh. He has been an advocate for issues of addiction and mental health concerns. All you have to do is Google him to learn more about him and in reference to his history. There is a link in the information box of this video so you can learn more about Mayor Marty Walsh. Mayor Marty Walsh gives me the courage to go forth and speak and share my story, not just in relation to VenFin Corporation, but in relation to everything that happened to me in the last 16, 18 months and in my life story. Mayor Marty Walsh's willingness to talk about his own personal story gives me the courage to talk more and disclose publicly my personal story. Because there is so much shame and stigma in our culture still, even in the year 2020, about mental health. So much stigma, so much shame, so much silence. By breaking my silence and vocalizing my story and who I am, I believe I can inspire others to break their silence and share their stories and who they are. So this disclosure, this portion of my video series is being inspired in part by this local person, Mayor Marty Walsh, and his courage to share from his personal story. I am also inspired, I will say, by the governor of Massachusetts, Governor Charlie Baker. His management of the COVID-19 pandemic has been a source of inspiration to me, especially when you compare it to the governors of so many states who have refused to do such things as simple as strongly recommend or even require their residents to wear masks. Now, I'm not going to go further into the whole story of the pandemic and go on that tangent now. I'm only saying this to articulate my feelings regarding two major government officials of the state of Massachusetts who inspire me. Mayor Marty Walsh of the city of Boston and the governor, Governor Charlie Baker. So, as I was driving back to Massachusetts, I decided to stay at a hotel in Pennsylvania. I went up to my room and I misused a prescription that I actually was not even actively supposed to be using anymore. And I went down to the lobby of the hotel, and at that time the medication was starting to strongly act in my system. And I passed out. I fell forward and hit my head, then I fell backwards and hit my head on, I think, what was a marble floor in the lobby of this hospital, of this hotel. I came to with the front desk agent basically telling me to not move and making it clear something had happened. I was taken to the emergency room. I had extremely low blood pressure due to the medication I had taken. I was taken to the emergency room and I was hospitalized there overnight. And so the way I started the year 2020 is so metaphorically appropriate for what the year 2020 has been. A year of nightmares and healthcare challenges and pain and suffering and loss that so many in this world are experiencing. I began 2020 in a hospital due to misusing a medication. I was then transferred to another hospital, yet again, an inpatient psychiatric hospital. And yet again, the providers of care there did not provide me the best help. They told me when they were meeting with me to discharge me to go back to Massachusetts and just simply get a job. That was part of what their discharge process was for me. Go back to Massachusetts and get a job. You can get a job. And it's not that I didn't think that I couldn't get a job. It's that I felt something was still fundamentally wrong with me. It's that I felt that no matter everything they did while I was there still was not the care that I needed, and that something was still wrong. And I felt it so strongly in my heart and mind that something was still wrong. But nobody around me was getting it right. Nobody around me was getting it right. And that was terrifying for me. Because if you can't go to your medical care providers to get the right care for your health, who do you go to? If you can't trust the system that you're living within, what do you do? What do you do if you can't find people that are going to get it right? And that's part of the problem with our healthcare system, not just in the state of Massachusetts, I would argue, but in this country, is that getting the right care comes down to luck too often, too frequently. Getting the right doctor, the right care, the right diagnosis, finding your way to what you need is too often a product of luck. Luck. That psychiatrist that I saw in September who put me on the wrong meds, that is another in this sequence of events down the path that I journeyed on, that if that particular moment had never happened, maybe I would have gotten the care that I needed sooner. Maybe I wouldn't have lost September of 2019 and October of 2019 and November of 2019 and December of 2019. Maybe I would not have lost so much time in my life if I had gotten the help that I had needed sooner. Years ago, decades ago. What if I had gotten it sooner? What if I had gotten it sooner? But I didn't. I kept getting hospitalized. I kept losing time. I kept losing life. Precious days, weeks, months, gone forever now. While I continued virtually flailing about trying to find someone to help me because I knew in my brain, in my mind, in my heart, something was still wrong. Because I was feeling suicidal and there was still something wrong. I could feel it. So, I was discharged from that hospital, that psychiatric hospital in Pennsylvania. Fortunately for me, the hotel where I had stayed allowed me to just leave my car parked there for 2 weeks while I was in the hospital. So I went back to that hotel in mid-January, and on a cold, foggy, gray day, I walked into that hotel lobby, and at the time I walked in, there was a show playing on the television that was a show that I watched avidly for years. It was the show Criminal Minds. I have watched the show Criminal Minds many times in my life because it is a very well-written show. The characters that are written are awesome, and it pulls you in. The pace of it, the writing, the complexity, I think it pulls people in. It naturally pulls you in if you appreciate that genre whatsoever. But on that day when I walked into that hotel lobby where I had fallen over and fainted and hit my head only about 2 weeks before, when I walked in by myself in a state that I have never lived in, except for those 2 weeks in that hospital when I walked into that hotel lobby and I looked at the television in their lobby and I saw Criminal Minds was playing. I felt one of the most profound feelings of loneliness and despair I have ever felt in my life. And why I felt that way was partly because watching that show, I remembered all the times in my life that I had spent my time watching that show, watching a show focused on criminality, pain, suffering, murder, injury, disability, horror, all of that time, all of those hours of those episodes I had watched, instead of looking at the beautiful sky, finding people to play with, finding people to talk with over a cup of coffee, finding a joyful life, creating something that I want to wake up for every day. In that moment, when I walked into that hotel lobby, I felt such despair and emptiness and loneliness inside because there I was in the coldest days of the year in a state that I had no friends in, basically, in which I nearly died. There I was standing there on a gray, cold Pennsylvania day in a state where I don't have a single friend outside of a hospital, all alone in a space where I could have nearly died, picking up my car and trying to move on to the next step, which I didn't know what it would be because I still felt sick and I still wasn't getting the help that I felt that I needed, and I still wasn't finding anyone who was getting it right. That moment in January of this year was horrifying. Horrifying in the emptiness and loneliness that I felt. Horrifying. Absolutely terrifying. Seeing that show on the TV, it's like it took my breath away. The life breath, the life force within me. I saw that on the TV, and I decided in that moment that I wasn't going to watch that show anymore because now it was a permanent association with one of the worst moments in my life, namely picking up my car at a hotel where I didn't know a single soul, in a city where I didn't know anyone outside of a hospital, in a state where I didn't know anyone outside of a hospital, to travel back to a state to still try to figure out what in the world was making me so sick. And so I left. But I didn't leave Pennsylvania that day. I stayed overnight because I felt that driving back immediately after 2 weeks in a hospital wasn't the best choice, because another thing that had happened on my way driving all the way to Arkansas and back was I had had these thoughts of driving my car off the road and killing myself that way. When I wasn't worried about the sky falling down upon me, I was feeling terrified being behind the wheel. I might drive off the road and into my life. And so when I got back to that hotel, I picked up my car. I went to stay at a hotel that to just allow myself to be in a space of safety, to not be in a hospital, but to not yet put upon myself the expectation of driving. And so I stayed in a hotel, and then the next day I left Pennsylvania, and I successfully drove all the way back to Cape Cod. I felt an immense amount of sadness and pain and despair. My aunt had died. I had been sick for weeks and months. I had quit working due to a bad experience with an employer. And now let me go back and share one more bit about VinFin, about another thing that happened that was so difficult to experience. In early December of last year, over a month after I had been no longer an employee of the company, I received in my personal email account, not my work email account, I received in my personal email account an email from employees of VinFin who were sending this email to another employee of VinFin, and that email contained sensitive confidential information related to this one employee's potential healthcare election, namely what kind of insurance she might purchase and what it might cost. And I was really angry. Why? Because yet again, VenFin was demonstrating an apparent inability to do the most basic things that a company that should be respected as much as it purports to deserve. It emailed me something that I should never have received in my private email account over a month after I was no longer an employee. This was a complete violation of this employee's privacy. And it was outrageous. Because by that point, I had already had the tug of war with VenFin when I was, responding to these investigations they had done. This was after I had worked for them for months, after I had worked for them on 4th of July, worked for them on Memorial Day, tried to be the best employee I could, terminated my employment, moved on, filed a claim against them with the Massachusetts Commission Against Discrimination. And they couldn't even be so responsible as to ensure that I would not receive anything from any of them in my private email account of anything. I mean, I didn't want to hear from the company at all unless it was through my lawyer. But not only did I hear from VenFin, I heard from them in an email sent to my private email account that had information that was not for me to see. It was a violation of their privacy. It was a violation of basic, sensible policy that any company should be following. Namely, you protect the financial information and records of the people that you employ as well as the people that you serve. You don't allow that kind of information to just be shared with people in the public domain. That is completely irresponsible. Completely irresponsible. It was just outrageous. And so there I was in December when I was getting sicker and sicker, getting an email from VenFin and just opening it and being like, what in the world is this? What is wrong with these people that they cannot operate a company better than this? It was outrageous. And then I made it known that I had received this email, and I get an apology about it, like, we're sorry. It's like, okay, thank you for the apology, but what in the world is going on with you people that you emailed me in my private email account something that I should never have seen? I don't even know how they would have put my email information in the hands of the people that inadvertently used it. Where would they have come up with that? So this company, VenFin, violated my trust repeatedly. It does not deserve the trust of the public. It does not deserve the trust of the public to provide care and resources to the most vulnerable people in the state of Massachusetts. People who have disabilities, like I have one. So, I drove back to Massachusetts in January of 2020. I still felt something was wrong, and so I got myself into the hospital again, because that was the only place that I felt safe, was that maybe someone would finally get it right. I went through Falmouth Hospital this time. I went through the emergency room at Falmouth Hospital, and they ultimately transferred me, after a few days there, to another inpatient hospital. And this one finally got it right, because I happened to meet one amazingly good doctor, a psychiatrist there, a young man, at the beginning of his career, who did something that helped me finally get past the point I was stuck on. Finally, someone got it right. After months and months of me suffering and feeling like I was going to die, or the sky was going to fall upon me, or I was going to drive off the road, finally, a doctor got it really, really right. And in the next episode, I'm going to recount that portion of my life. So now we are up to January of 2020, and we are going to start there in the next video. So once again, this series of videos that began way back with episode 45 has been focused on my life history from April 2019 to the present moment. My history of working for VenFin Corporation and what has evolved since then. These videos are designed to inspire fundamental positive change in the healthcare system in the state of Massachusetts and beyond. Thank you for listening.